This is Annai Satya, Assistant Professor, SNS College of Nursing, going to talk about the business model Canva applied to a nurse-led home healthcare service. Healthcare is changing rapidly, and one of the most important shifts we see today is the movement of care from hospitals to homes. Patients now prefer receiving treatment in a familiar as well as comfortable environment. This is where nurse-led home healthcare service play a vital role nowadays. To understand how such services can be planned and managed effectively, we use a tool here called the business model Canva. It helps us clearly define how a service creates value, delivers care, and sustains itself financially. Let me explain this model in the context of nurse-led home care services. First, we took at the customer segments. The primary customers here are the elderly patients, post-surgical patients, and patients with chronic illnesses like cancer, tuberculosis, and all. And those requiring a long-term care at home, example, unconscious patients, stroke patients, etc. These group benefits the most from continuous care. Next is the value proposition, which is the core of this model. This service provides personalized high quality nursing care directly at home. It ensures comfort and reduces hospital visits and lowers infection risk also and improves the patient satisfaction. Most importantly, it brings healthcare closer to the patient. Moving on to the channels, services are delivered through here or home visits, through phone calls, and through mobile apps and telehealth. This makes care easily accessible to all the individuals as well as the community. The next component is the customer relationships. In nursing, building trust is more essential. So, nurses provide continuous care, not only the physical care, we need to concentrate on the emotional care also. We need to give emotional support and we need to health educate the family to how to take care of the patient. Not only to the family, we need to give health education to the patient also. This builds strong relationship and improves outcomes. Now, let's look at revenue streams. Income is generated to service charges, home visit fees, and care packages. There may be also partnerships with insurance providers also. Next is the key resources. The most important resource is skilled nurses. So first is nurses are the main sources here. Other resources includes equipment such as BP apparatus, then blood sugar monitors, then transportation and digital systems. Then we have a key activities. These includes the first and foremost thing is the assessment. So assessment of the patient. We need to give medications, medication administration, wound care and monitoring like lab investigations, blood pressure monitoring, blood sugar monitoring and all and documentation. So each and every activity should be mainly recorded. These activity ensures safe and effective care. Another important component is the key partnerships. Nurses work closely with doctors, hospitals, labs, pharmacies, and insurance companies also. This also ensures a complete and coordinated care, that is, he needs, the nurse needs to completely work with a team, that is, multidisciplinary team is involved in this care. And finally, we look at the cost structure. Major cost includes staff salaries, medical supplies, transportation, training and operations. Managing these costs is important for sustainability. Let me give me an example. A patient recovering from surgery can receive a wound care at home from a nurse. This reduces the hospital visit, that lowers the cost and improves the comfort for the patient as well as the family members. In conclusion, a nurse led home healthcare service is a practical and growing healthcare model. The business model Canva helps organize in all aspects of the service from care delivery to financial sustainability. And the most importantly, it supports patient centered care. So, the home led care service is one of the most emerging business model Canva. Thank you.